I'm going to add some brief voice over comments to this PowerPoint. I've been having trouble loading it into Canvas since the file gets too big if I add more than a few brief comments. The introductory slide certainly shows how important environmental factors are as we consider what our responsibility is in promoting population health. This is a great slide that shows that the cost of the strongest research studies is greater than the cost of the weaker studies. The other thing to consider is that when we're studying environmental health, there are a number of these research studies on the higher end that are impossible to do when you're looking at the health of an entire population. So often we're left with those that are more in the middle sector. This slide describes how retrospective cohort studies are often used as some of the strongest studies we have in studying the impact of the environment on a population health. So please read this and study this slide carefully. This slide gives an example of a retrospective cohort study and how valuable it can be to study the impact of an environmental hazard on a population. These studies are often used in this kind of environmental health research. We know that biases are to be avoided at all costs because they reduce the validity of any research study. So in the same way in an environmental study, we want to avoid bias at all costs. One example is the healthy worker effect, and you should make sure that you know and study this for the exam. Cross-sectional and case control studies are also used in environmental health. An example of a case control study was done, I believe this was in Japan, and it was looking at the synergistic relationship between asbestos and smoking in causing lung cancer. So it was done among those people who worked with asbestos insulation. They studied 370 workers for over a period of 4 years, and they found out that out of those 370, 283 of them also smoked. So that's the synergism. Is the combination of asbestos and smoking more damaging? They found out that those who smoked, 8.4% developed or died of lung cancer, and of those who did not smoke, none of them died of lung cancer. So you should understand the concept of threshold for the exam. It's the lowest dose at which any particular response may occur, but this response may not necessarily be a health response. Please look at the line graph in the next slide, and I think it'll make it clearer. We are used to thinking of sentinel health events as occurring in an acute care environment like a hospital, and we know that often it's followed up with root cause analysis. But sentinel health events can also occur when we're considering the impact of the environment on population health. This slide introduces a new science called epigenetics, which is the study of how environmental exposures can change not the actual DNA, but how the body reads that, and therefore it affects the phenotype, which is the exterior. It's what we see of a person as their phenotype. Here is an example of two mice. In the lighter coated mouse, the overweight one on the left, the environment caused the gene to be turned on continually, which is it wasn't supposed to be turned on continually, causing obesity in the mouse.